Well, it takes the proper diagnosis, it takes the right surgery done well, and usually this baby will look normal before lunchtime. So these are very gratifying cases, and one thing that makes the surgery on infants so interesting to me as a pediatric plastic surgeon is that we're not simply making things look right at the moment, which is what we do with adults. But babies grow over time, and so what we do has to be designed to grow with them. And so that additional dimension makes things interesting. And when we see complex cases that have perhaps been taken care of elsewhere around the country, that have had perhaps good results immediately, but as that baby grew, the results sort of got worse again. We think that this happens because the surgical strategy or the way it was executed fell short of the mark. Now, there are other reasons. Sometimes the genetics involved can be more complex, and whatever we do as surgeons can sometimes be overcome by what is inherently wrong at the molecular level. But typically, we can take a baby, a child, a teenager, or an adult that has had this kind of surgery and had suboptimal results and get them to where they need to be. So the idea that this must only be one operation is not true. We certainly hope when we're taking care of babies that we can get it right in one operation, and we frequently do, and it'll improve as they grow. But when it's not right, we don't want to leave these children to deal with that kind of difference. The difficult cases that we see are typically those patients that either have the genetic form of craniosynostosis or patients that have had multiple previous surgeries elsewhere that have not gone well, that have had complications. And I see quite a number of children who've been treated in other states, who have had poor outcomes from the surgery, who still have the physical manifestations. They're now dealing with bullying and teasing in school because they don't appear like the other children in school. And they may even have ocular problems, developmental issues that parents pick up on. But again, these are subtle findings that take time. The ones that are typically picked out are the ones that really do look different. And so they'll start looking around to find someone experienced enough to deal with these problems. Many of these cases require not just successful surgery at the time and low risk. I think a big part of our formula for success is that we follow these babies longitudinally, because there aren't any good lab tests that we can follow. We can't simply get a blood test and look at a number. What's important to me is how that baby is developing, how they're performing in school, and certainly whether things look the way they should look. As a craniofacial surgeon, we know that if something doesn't look right on the outside, it may simply be the tip of the iceberg, and it'll frequently help us find other issues that are a result of this.